Hi, all. My name's Tom Cassels from Rock Health. I am very excited for this panel today on neurodiversity. This is both an area in which I do work, but also an area in which I lovingly live with family members that are neurodiverse. So I'm extraordinarily excited to have these two wonderful women with me today, and I'll actually let the panelists introduce themselves. And one thing that would be great is to tell us a little bit about your organization and maybe a little bit about what we need to know about you to understand why you're building what you're building.
Yeah. Great question. Thanks, Tom and Salome, for everyone for having us here. My name is Marissa. You can call me Missy. I'm one of the co-founders of Beaming Health. We're focused on supporting neurodiverse families and finding the different care options and resources they need, especially early in the journey. This problem is super personal to me. Like Tom, I have a neurodiverse family, and it's just way harder than it should be to find some of the most basic resources. A parent told us recently getting a diagnosis right now is like being pushed off a cliff and told to find your own parachute. So that's what we're working on, and just excited to be trying to make it a better experience for families like ours. It doesn't really feel like a job.
And I'm Rebecca Egger. I'm CEO and co-founder of Little Otter, which is a digital health company focused on mental health care for children and their families. So really providing a holistic view of providing mental health care to everyone in the family unit who needs it, because when one family member is neurodiverse, it has an impact on many others. And also, it often is related to genetics. And so instead of looking at this idea of, bring your problem child to a therapist or a provider, how do you really look at it holistically? And I have struggled in my whole life with ADHD and anxiety, but I was really lucky because I got help really early. And my mom, who's also my co-founder, is a child psychiatrist. And so a lot of Little Otter is about how do we bring the good experience? How do we bring amazing, high quality mental health care that I was lucky enough to receive? So now I can run and build a company and bring that to other families so they can be set up for success.
Thank you. It's so I often find it's just absolutely critical to really understand a company by understanding the builders behind it. One thing that I'd love to start with, I'm a big fan of starting with the end in mind, is a question for both of you. I spend a lot of time, both professionally and personally, thinking about what does winning look like for my son on the autism spectrum? What does winning look like for I myself have major depressive disorder? What does winning look like for my mother living with Alzheimer's? So what's your hope for the future of care for neurodiverse individuals?
I mean, I'll go first, and then there's so many answers to this. I think the biggest one for me, and this is why we're focused on the youngest population, really children under the age of 14, is making identification part of everyday life. And so you don't have to have that family who is constantly having to advocate, constantly, handling everything themselves. And so what we're really trying to do, and our dream, is that it's like, just like going to your pediatrician and they do height and weight checkups, they're starting to do that for autism, but we're not doing it for ADHD, anxiety, depression, which show up at higher rates than autism in young children, right? And the answer, and we can talk about this later, is because it's very hard to do. So it's understandable why it hasn't happened. But, I keep thinking about it, like, what if we had a generation that actually got the help when we needed it, right? That ends up having such a wide impact on teenagers, adults, et cetera. And so the end game for us is let's support people as early as possible. And so they can, have the biggest impact on their lives.
That resonates in a huge way with me. I was raised by first generation Irish Americans, Irish Catholics, and I don't know if you know this, but there is no mental health issues in the Irish
none.
Catholic
community. No, of course. No.
So the distinction between we were lucky enough with my son to intervene early, and it wasn't, none of it was easy, but it was early, and it makes a difference. So thank you for that.
Exactly.
Missy, what do you think?
Yeah, totally agree. And couldn't agree more with all of the things you both just said. The other thing, in addition to that, I would add is just getting to a place where we have a much better understanding of what works for whom and when, just in behavioral healthcare in general, but also especially in this space. It is just a really, again, hard thing to know the answer to, but just working toward knowing, these types of therapies support us getting to these great outcomes, and making sure the care is collaborative and personalized, just because every individual and every family is so unique. I'm really excited about that, and just helping all of these now young children eventually live more independent, fulfilling lives, and not focusing on conforming to a norm, which I know can sometimes be a challenge right now.
Yeah, I have one of my favorite stories about this is my brother has a very rare autoimmune disease. So we went through the system of going through the care system as a family, and he did this amazing program at NYU a couple of years ago. And he's doing great now. But one thing my dad said that has really stuck with me, and I feel like we try to bring a Little Otter, and it's exactly what you're talking about, Missy, is this, he's like, I don't want to know how my son is doing compared to other children. Because I want to know how he is doing compared to him, because that is huge progress, right? So now he can be on his own, and now he can take a plane by himself. And that is transformative, right? But it needs to be compared to his own baseline and own level. And that's really just stuck with me, because it's exactly what you're talking about. And how great is that if we could look at people as individuals that way?
Amen. So with that as the end, maybe let me take several steps back. And obviously, both of you are supporting families of neurodiverse youth and adults. For those that don't know your organizations as well, can you talk a little bit about your companies and maybe your biggest initiatives right now?
Mm-hmm. Yeah, definitely. I can start. For us, for Beaming Health, we're really focused specifically for now on autism families at the earliest part of this journey. I loved what you were saying earlier, Rebecca, about just, the earlier we can get folks the right resources just makes such a difference long term. So that's where we've chosen to focus too. And our biggest initiative right now is just how can we stand up a care model where families get access to the right care and resources as soon as possible. And just getting screened, getting diagnosed, and getting set up with all the right resources and services for them, just knowing that will pay so many dividends long term for the whole family unit, like Rebecca was saying earlier. So.
Yeah, and that's a complicated thing to do. My wife and I work for the early intervention in the public school system in Arlington. And one of the things that I'd be interested in your take is when we meet parents, it's almost it's the opposite of double dating. Frankly, the mom goes and talks with Allison about really meaningful things, and I sit awkwardly, often with a beer with the dad, who's like, I'm not exactly sure why we're here. And I'm not trying to paint a broad picture of dads as being kind of recalcitrant, but you do need, like, different members of the family have very different needs. And, I'd be interested in your take on that at Beaming.
Got it. And just to make sure I'm understanding what you're saying just different members of the family unit, maybe just having different levels of understanding of what's going on. And
different levels of understanding of what's going on, being at different points of acceptance that there is something going on. That to me is a big challenge for families.
Yes. No, I definitely see it. I see it in my own family and lots of other families, and it can be really challenging. I think for those conversations with those different family members, whether it's the dad or the grandparents or others who just are not as understanding of what's going on, I think just coming back to a place where there is common ground of, hey, we all want these kids, our kids, to have really incredible lives where they're independent and fulfilled and whatever that means to them. And I think just starting from that common ground can be really powerful to say, like, hey, these things, these therapies, these different resources are going to help us all reach that outcome that everyone wants. That to me is sort of the advice I've given to different parents of how to get folks on board and just start working toward this idea of, like, okay, great. Yes, I'm on this team. I'm part of this objective and, like, want to be bought in on this because I want that outcome.
Great. Rebecca, can you tell us about some of the big initiatives going on at Little Otter?
Yeah. I'm also just thinking about what you two are talking about, because there's there's so much stigma, shame, complicated other feelings that we're trying to work through. And I think besides just our product initiative, we spend so much time. We feel like a huge part of our work is education and awareness, right? Which is, how do you explain that children, it will work, that you will see the impact, that it's worth it, that all of these other things, that it's not your fault, right? And that just, is going to be what's necessary for every single company in the space to start moving all of this forward. In terms of our big initiatives, I mean, we really were lucky to have proven out our care model earlier this year and late last year, and have really just been focusing on growth and expansion as much as possible. So figuring out, how do we get in more families' hands and provide them an even better experience, really focused on improving our assessment and early identification. We've released these things last year called our mental health toolkits, that are free resources that provide really personalized feedback for parents, really looking at whole family mental health. And actually, we're just releasing an updated version in our product that is our mental health checkup, that gives an entire 360 view of the mental health of an entire family. So really helping to kind of put this idea together of, this is maintenance, right? The mental health of everyone in your family, and kind of going back to how we bring the whole family members in, is it's like, yeah, this is not just about your kid, right? You also are struggling. Let's talk about that. Let's bring you into the conversation. And one of the huge benefits we have with telemedicine is we've seen way more participation from dads than we ever have before, right? And that is a huge benefit, which most people didn't think about, because both parents can call in, And so small things like that, are going to start to change, move the needle.
Yeah. Given that work that you've been doing around education, kind of an obvious question is, what do people most often misunderstand when it comes to getting the right care for their kids and for their mental health needs?
Yeah. Well, there's a lot of, it's so interesting, because there's just so much, not even misinformation, just not information about early childhood mental health. And I know all of us know this and we've all struggled with it. But, young children as young as 3 can have depression, right? And we can treat these things through telemedicine. And to me, that's the biggest thing that people don't know, is that children are actually suffering, right? It's about creating and turning them into amazing adults that can thrive and have long and healthy lives. But it's also, children under the age of 1 are suffering. And how do we relieve their suffering, right? And we can help them. And so I think there's just not information about it, because people still don't really see children as people oftentimes. And that's kind of what we're combating.
Yes. I think that it is interesting that you kind of see two different sides of the coin. Some people who are like, well, children are just small adults, and I know how to work with small adults, versus what you just shared, that they are just people like everyone else. Missy, when you're supporting parents of newly diagnosed children with autism spectrum disorder, and you're helping them to access personalized roadmaps for their families. Talk to me about choice for those families seeking care, because personalized is the key word, and too often in healthcare, when we think about patient journeys or roadmaps, we think about, well, what does the clinical evidence say, and let's do that 100% of the time. So how do you think about that? Giving people the ability to have choice.
Definitely. No, great question, Tom. And 2 things instantly come to mind with this question of just, there are 2 things we fundamentally believe around, if you've met one child with autism, you met one child. And then the second thing we like to talk about is just every parent or caregiver is the expert on their own family. Who are we to tell you about what might be best for your family? You as parents know it so much better than us. So we see our job really as empowering parents and families with the information and resources they need to know, hey, here's what we think could be helpful for you. Here's why. Here are things that you should know about and take into consideration as you're making these decisions, and giving parents more frameworks on how to choose the right therapy providers for them or the right schools and things like that. We think it's really powerful to be able to give the families ownership in that way. The other thing I would say that you made me think of is just quality in behavioral health care, or why choice is so important in behavioral health in general, definitely in autism, but broader behavioral health. And just quality is so in the eye of the beholder, is what we've seen with the families we work with. Families have different preferences and communication styles, and just the relationship between the therapist and the family can just, maybe not be quite right. So just giving that autonomy and choice back to families has been really cool, just to make sure that they're getting to what's really the right fit for them.
Yeah, I think right fit. I sorry for always bringing it back to personal experience, but I'll never forget. We when we were starting ABA therapy, our ABA therapist showed up and was 6'7", completely inked up man. And I was, first of all, confused. I thought maybe we had construction workers coming. I had not met him before. I was like, this can't work. And he was unbelievable. Like someone I treasure today. But people are in different places. And everything can make a difference when you're when you're making choices that you don't really know how they're going to end up.
I will say though, I agree with this, and we are always believe that families, like, I mean, we're 100% in agreement of like, families know their kids best. That comes from our own personal experience of my mom not being listened to or trusted, even as a doctor while she was navigating the system. But I think something else that we deal with in education is that many people, and this is not just parents, do not know what good mental health care looks like.
Yeah.
There's no standards of it. I mean, there are a few, and there's a few places that you can find it. But when you say outcomes, everyone thinks something different, right? When you say, and so, I think something we've also struggled with, because we are so focused on quality. And once again, not just quality looking at parent experience, how parents feel, the matching, everything, and the outcomes is, it can sometimes be hard because you're saying, we are quality when there's not really a standard of what quality is out there. And that's also, I will say, just devil's advocate, is really, really dangerous for families, because they can go to a place and we see so many children who've gotten really terrible care. And the parents, the reason they come to us is it's not working, right? We've seen many families who've tried up to 10 interventions before coming to us, right? And so even though that's great that there's access out there, something we talk about is we're improving access to actual quality care. And we need to add that quality bit, because access for access sake does more harm than good in young children.
Mm-hmm.
Yeah. Kind of the joke in the local neurodiverse parents forum is, if I can get an appointment, I don't want it. And that speaks to, the catch-22 of access.
Exactly.
One of the things that, a bigger issue, but really critical here is, there is a broader, what we've been talking about is there's just a broader impact than the individual who happens to be neurodiverse. And if you think about, the impact on caregivers, there are decision makers, employers, in the way that they design their benefits, in the way that they work with parents who have different needs and different needs for flexibility. I guess a question for both of you is really around, why should employers care about issues around neurodiversity, particularly in this moment in time?
Mm-hmm. Yeah, I can start. For employers, a few things come to mind. Just neurodiversity, like all diversity, has so much value and can bring so much value to an organization. So that, just for starters. And then second, I think it's just so much more common and prevalent than people realize. I think sometimes when I hear conversations around neurodiversity, I get the sense that people think, oh, this is a really niche, small group. Like, do we really need to invest in all of these different things to support this group? It's like, yes, you do. It's, really significant portion of your workforce, likely. And then the second one for families, just knowing both Rebecca and I are focused on families here, is just a lot of research around how much time and energy these families are spending on care and resources. We have a study we were just reading about, generally for families, it's 7 hours a week, roughly 44 working days a year, that they're spending on navigating a lot of these different care challenges that they're facing with their families. So for whether their employers are thinking about individuals in their workplace or neurodiverse families, there's just so much to think about and support.
Yeah. And I think we want to support people who are having children. right? We want to support families. This is like our next generation. It's very, very important. And, our government systems are failing in a lot of ways. And so employers need to pick up the slack. And this is very, very important for them to do, right? Because when you have a child who's suffering, it is impacting the parents, the caregivers, the siblings. It has this ripple effect, right? That no one else even sees. And so by really supporting this family unit, you're actually impacting many, many lives, right? It's not just the one that you're serving. And so I think that's why it's so important to invest in for your employees' happiness, success, but also just like longevity of whatever you're trying to build.
Yeah, there's so much interconnectedness there, and I think a challenge for all of us working in childhood mental health and mental health in general have to really kind of fight the battle to make this as obvious as paid time off.
Yeah. Well, especially because, going back to what you're saying on the gender side, this disproportionately affects women.
Yeah.
Right. And so a woman who is suffering because their child needs, you need to be, let's say, for ABA therapy every single day, and you're driving them around, they're most likely statistically to be the one to drop out of the workforce. Right. And so we need to provide this support. We need to, employers need to make sure that these things are covered so they can keep and retain their employees and have, a happy and productive workforce.
Yeah, that hits at home as an employer myself, with 85% of my employees are female. So I need to eat my own cooking here. But I think one of the things that you're attacking is you probably, in a perfect world, you could control all of the variables that come into play for your families. But we live in this world. Who are your most important partners? Some people I talk to talk about school systems. Some people talk about pediatricians who are just very uncomfortable, acclimating that this is all going on, as well as the physical health side. I'd just be interested what you all find are key partners for you in your work.
Yeah. Well, 70% of all mental health meds for young children are prescribed by pediatricians. 70%. And the average pediatrician has zero mental health training. That is not their fault. And I think that's what's important about this. They are asking for help. They want to do the right thing. They just do not have resources. Families are coming to them for help. They're trying as much as they can. And so I think for us, really pediatricians and anyone else in the family system is very, very important. And then I wouldn't say school systems. I would say teachers.
Yeah.
The teachers who are interacting with the children every single day, they have the most impact on the child's life. They're talking with the family. They're often the first to realize something's going on. There's this is not statistically true. There hasn't been a report on this, so just caveat there. But, I think that many of the reasons why there's been such an increase in issues with young children during the pandemic is that kids are finally at home with their parents. And I've talked to teachers who are like, yeah, of course these kids were suffering. We were with them all day. We couldn't get them to sit in a classroom. They were crying. We were having these issues, right? And finally, parents were spending hours and hours with their kids and were seeing what was going on. And so teachers are often the first line of defense and have a lot of insight. Also, children act very differently in their homes than they do with teachers, and being able to understand the difference. Like going back to my mental health checkup idea, you can't just ask a 3-year-old, are you depressed? And you also cannot ask the parent if their child is depressed. We have to ask the child questions. We have to ask both parents questions. We have to ask teachers and pediatrician. And we put all of that together to do our assessment and a holistic view of a child, because you really can't rely on just one report. And that's where engineering and tech and data come in. But I think all of this is just emphasizing your question, which is just like partners are critical for this work in this space. And you can't exist without working closely with them.
Yeah. Thank you. Missy?
Yeah. Underscore both of those for us. The first, though, that came to mind for me, just thinking about a broader system level, actually, for us as payers. Reason being, for neurodiverse, there's so much power in how the reimbursement flow impacts I know it's not long, but just coverage, the appropriate amount of coverage, and thinking about new types of resources and services that are covered, to me, is one of the most powerful forces for solving a lot of the problems, at least we're seeing with our families. So many of our families are forced to be paying out of pocket for additional therapies and resources that honestly should be covered by insurance or different types of services that could add a lot of value that aren't being covered today. So I'm just really excited about payers and leaders, and a lot of different payers who we're so lucky to talk to and work with, that are starting to think more creatively about the model of supporting these families as not being this more traditional medical model, and just thinking differently about it. And I think once a lot of those new payment models and things get covered in real traction, it's going to be really, really incredible for a lot of families.
I know I'm nodding along vigorously. I just think I kind of went on in my thinking about partnerships of who we work with, but I think the most impactful for us would be if insurance companies could really wrap their minds around this whole family care model and think about it differently instead of the way that they've been doing it, and really figure out some of these reimbursement rates, et cetera. We're, working on it. That would have the biggest impact I think, for us, and I'm sure probably for you too.
Yeah. Well, I could talk all day to you all. I have one question that I always ask of people in the field, and that is, given all the hard work that you're doing, and it is, it can be rewarding. It can also be challenging some days, a lot of days. What's one thing that makes you optimistic about what you're learning in your day-to-day, working with families and working to grow the impact of your businesses?
The first thought that comes to mind is sort of similar, Rebecca, what you were alluding to a bit earlier, is just on an individual level, at least for me, is what gets me so excited, the family level, just seeing quality care getting results. It sounds so simple, but I think, at least for me, on my worst day, we have a channel in our company Slack that's completely dedicated to just wins like this for families, and just hearing those individual stories of, these families got access to the right care, to quality care, and it is transforming their experience. It's something so magical. And at least for me, it's okay, we know what we need to do. We just need to keep moving the needle, getting it to more families. And yeah, that's at least what does it for me.
Yeah. I completely agree. And it's insanely rewarding. I think also just really feeling like the tides are turning, that, the same amount of kids have been suffering from these issues for hundreds of years, right? And finally, this is on the front page of the news, and people are aware of it and talking about it and care about it, from employers to payers to all of the amazing companies that are coming in this space. And that's really exciting, especially because we all can't do everything. right? And so I think something that's really inspiring is to see like beaming health, right? And seeing what we're doing and saying, how do we connect together to create a better ecosystem for families? And that's really exciting.
Well, talking to you all is what makes me optimistic, and I appreciate the chance to do that today. Thanks, Salome, for bringing us all together. Thank you both for sharing with us, and I look forward to the great paths that you're going to be blazing.
Thank you so much for talking with us.
Yeah, thank you, Tom.